This is a short video showing my technique for insertion of the Malyugin ring. Um, in this technique, I first engage the leading scroll, followed by simultaneous engagement of the two side scrolls. The Malyugin ring is a pupillar expansion device that is easy to use and easy to remove. Once the side scrolls are engaged, the next step is to disengage the inserter. Oftentimes, you can insert a second instrument through the side port incision or through the paracentesis. However, I find in most instances I'm able to disengage the inserter without having to resort to a second instrument. The final step is to engage the trailing scroll. Here I'm using a Lester hook for this purpose. Then the ring is centered and cataract surgery may proceed. Another video showing the same technique. The leading scroll is engaged, followed by simultaneous engagement of the side scrolls. In order to do this, I typically will engage whichever scroll is easiest and then will tilt the ring to engage the second side scroll. Once again, I disengage the inserter without having to resort to a second instrument. Here I use angle McPherson forceps to engage the trailing scroll. Some surgeons insert an instrument through the paracentesis to engage the final scroll. It's also helpful to inject viscoelastic underneath the iris to provide space for the Malyugin ring to engage the iris, as shown here. Once again, the leading scroll engages the iris, followed by the two side scrolls. This is a case where viscoelastic was not injected underneath the iris, and I have some difficulty engaging the leading scroll. In this case, I used a Lester hook to push down and guide the leading scroll to engage the iris. The two side scrolls engage without difficulty. Another case with a similar situation, in this case I inject viscoelastic underneath the iris to allow for engagement of the leading scroll. And again, the side scrolls are engaged without difficulty. Thank you for watching this video. I hope you found this technique useful.